And new at 6 tonight, hospital leaders in Monterey County say state-reported ICU numbers don't match up with what they're seeing on a day-to-day basis in their hospitals. Action News 8 reporter Caitlin Conrad takes a closer look at the staffing crunch that the healthcare industry is facing locally.
The state data used to determine ICU capacity shows Monterey County had 18 ICU positive patients and 18 ICU beds available as of Thursday morning. But local hospital leaders say those numbers don't reflect what's really happening.
What's publicly reported is kind of this weird derivative of a bunch of variables based on licensed beds, based on beds that we're calling surge ICU beds, based on how many COVID patients are in the hospital. It's kind of a complicated equation that the state has basically made up for this period of time. And it isn't reflective, as we've said over and over again, of the number of people that are in our ICUs right now and the challenges that we're facing on a daily basis.
In a county briefing on Wednesday, Dr. Alan Radner explained that his hospital, Salinas Valley Memorial Hospital, could add a ventilator to any bed and call it an ICU bed. But what he can't do is maintain the same staff-to-patient ratio that you normally need for a licensed ICU bed, a reality doctors at Community Hospital of the Monterey Peninsula are facing as well.
When you look at it, it looks like there are plenty of ICU beds and plenty of beds. The reality in many cases is that we just don't have enough of the staff to support huge increases that we're anticipating in the next couple of weeks.
Hospitals are doing what they can to address the staffing crunch. At SVMH, they've hired back nurses who have recently retired and are working to hire travel nurses as they become available. The problem is healthcare workers are in high demand nationwide, and the county's smallest hospital, Mead Memorial, says it's been priced out of the market.
We don't have the nurses, and the travel nurse rates have gone up significantly to where our hospital just cannot afford to bring those travel nurses on because the rates are so high.
There is no doubt that staff here at Salinas Valley Memorial and healthcare workers across the county are dedicated to their work. They've been working tirelessly for months now. But medical professionals say we are reaching the point where if the trajectory does not change, care will be impacted. Reporting in Salinas, Caitlin Conrad, KSBW, Action News 8.